I've been treating patients for a long time with chiropractic, acupuncture, functional soft tissue work, and people were getting better, but I noticed that there was something more going on with a lot of patients. A lot of people were sick. They needed more than I could give them. And they were looking for answers, and they weren't getting it anywhere. They weren't getting it from conventional medical model. They weren't getting it from, their physicians or really from anywhere. I was learning about functional medicine here and there, just, seeing different things, following living proofs, material. And then it just came to a point where I felt I needed to do something about this. I needed to be able to provide answers for these people and help these people and give them what they weren't getting anywhere else. So I decided to start doing functional medicine. This is something that I often hear from patients, is that they don't feel heard, right? Nobody listens to them. Nobody listens to their story. We need to hear about you, right? Because that's what we're treating. We're treating you. We're not treating a condition. You're not a labeled diagnosis. And then with functional testing, we're going to go much deeper and use a science-based approach to look at your cellular function, to look at your biochemistry, and figure out what's happening on a microscopic level. So we're looking at the overall picture in terms of lifestyle and diet and relationships and all these different things that are typically the root causes of the problems that are happening on a microscopic level. So we're really looking at this full spectrum and putting it all together and really trying to get as many pieces of the puzzle as possible to create the best image that we can so that we can address accordingly. My role as a practitioner to my patients is, number one, to be an educator, to raise awareness. The word doctor actually comes from the Latin term docere, which means to teach. So I always tell people, I'm not a healer, right? The doctor is not a healer. You are the healer. You, the patient, are healing yourself. Your body is doing what it's naturally designed to do. My role is to facilitate that process, to remove obstacles, and again, to teach you and advise you so that you can better navigate that path and again, get the most out of this amazing body that you have. This is my life's work. This is what I love to do. It's my mission. It's my purpose. So you can expect to have somebody with you along the way, helping you, guiding you, giving you everything that I have, all the resources that I have access to. I want to influence people to better themselves, right? They can influence their family, and then it just keeps going outward, and they influence their community, and ultimately we can influence the world like this by creating good health and creating freedom of health. So so that's my commitment to you. To find out more information, go to viavitaehealth.com. That's VIAVITAE health.com. And also check us out on Facebook. Become a fan of our page, Via Vitae Health. We share lots of useful information there as well.